and start exercising and dieting again, and then you go, oh my God, like I feel so much more. Why was I not doing this? Like I feel so much better, and it's like you get used to like the routine.
That's the lucky people. That's the lucky. Lucky people realize it and get back into it and feel that good health again. The worst thing is what we see all the time is the same person going to the gym, working out the same way, the same day, same time,
no progress
for years, and they look exactly the same as they did years ago, which wasn't that healthy then. But now they're 10 years longer, further along.
So what do you think is going on there? Is it just the fact that they're just not educated?
They haven't changed their
not doing the
lifestyle.
right things?
They haven't changed their lifestyle. They haven't changed how they eat. They haven't changed how they drink.
Right.
They haven't changed supplements. They're probably getting sicker and sicker, and that body's accommodating, staying at the level.
Yeah, they don't even know it.
They've actually probably been slowly slipping down a bad slide.
Yeah, and then really, unless you do testing to really
quantify
like what's going on, blood, urine, things like that.
Measurable results are the key.
Absolutely.
Measurable
Science.
Measurable statistics. This is where you are. This is where you want to be. This is where you were. This is where we got you, and this is where we're going. And this is how we're going to do it. And laying it out is as simple as it is. Simple as it is. No question. Pause. This is good. This is good. See the thing. We'll just keep talking. So I'm trying to think of the next thing.
I don't know.
Where are we going? Where are we going? Where are we going? You know what I'm talking about.
Yeah.
I've been on this. They don't look bad. Same person's in the gym. They look exactly the same as they did 10 years ago.
I'm thinking about this, okay.
That's better than some people though.
For our audience that's gonna watch this, I'm trying to think about like there's gonna be different, there's gonna be people that like really have no idea what to do. There's gonna be people that have been active, I mean, there's gonna be pro bodybuilders. I mean, like, look, I'm a retired professional IFBB pro bodybuilder. There's so much to know and so much to learn. I mean, when you really get down to the science of it, and technology and science and it's constantly evolving. New studies are always coming out. You are a wealth of knowledge, and that's why like I'm listening. When you're talking, I'm listening.
Right. As I am with you, because
so it's just like there's the different levels of like expertise.
But the thing is, remember, technology's going faster. The world's moving faster, but we're not evolving any faster. Our bodies still need the same care and attention that they did 1,000 years ago.
Right.
We're healthier because we've figured out how to treat diseases and sicknesses with technology, but we still get hernias, we still get bad gallbladders, we still have cancers that come about. Those are innate in us. We have not evolved enough yet as fast as technology has evolved.
And I guess that kind of brings me to like a question I have for you is like, for over 20 years now, you've been performing surgery, and you're kind of coming in to fix what's already messed up with people. And tell me, why did you decide to establish this business here, Synergy Health, and what was the reason behind that after all these years of performing surgery after the fact?
Yeah, after 20 years of seeing all the dysfunction and all the problems, and seeing that most of them came from what people did to themselves.
Yeah.
Even knowing that, even being an osteopath, thinking treat the cause, not the disease, I was still only treating the end result of the disease. And I kind of went, wait, this is crazy. Why aren't family doctors doing this? Because I was in the gym with you, you were there, we were doing nutrition, taking care of ourselves, nutrients, working out every day, living a decently healthy lifestyle all the time, just with weekends of some fun here and there, which everybody deserves, and they have to remember to keep that as part of their thing.
All about balance.
But how were these family doctors not taking care of their patients? They weren't. They do the same thing, an EKG, a chest x-ray, 2 or 3 labs, see a patient for about 5-10 minutes, listen to their lungs maybe, examine them maybe, and say, all right, everything's great, see you next year. The people walk out, and they're no better. People who come in for endocrine surgery, come in for thyroidectomies, and you look at them, and they have a goiter. And they have no reason, they've been on the wrong medication, treated with very simple labs, and symptomatology has not changed despite more, and it was simply me looking at lab work, seeing what was wrong, and the medicine they were given was causing a backwards reaction in the thyroid, making it to grow, to get bigger, to make more, and it was making more of the wrong type of thyroid hormone, not the right one. So I would end up treating patients instead of operating on them, getting rid of their goiter, and have an endocrinologist look at me going, what happened? And I said, well, I treated the patient. Because you treat the patient the right way with the right supplements and the right medications, because I actually went in depth, talked to the patient, and went through it, did it. Looking at colon cancer, so colon cancer, smoking, colon cancer, poor diets, gallbladder, poor diets, hernias, fat and poor diets. People aren't healthy. So I say, wait a minute, if I can do that, if I can start treating there, sure, I'm fixing the end product, but if I can go back and fix the actual cause of all this, I'm doing a lot more for my patients than just cutting a knife. Treat the root cause, which is the core of what I learned in the beginning anyway.
Right.
The other factor was, and why I didn't do it sooner, because we talked about that, was when I first got down here and people were doing hormone replacement, they were just giving testosterone. And you could do the same thing from your buddy in the gym and do the same thing, and those doctors were treating nothing else.
Right.
They were actually putting those patients at more risk. So
because there's just a balance, there's a delicate balance
absolutely.
there. And you can't just throw just a little bit of testosterone in the mix.
They weren't checking anything else.
Right.
Low T, here you go, here's your symptoms, here's your drug, see ya.
There's a cascading effect.
Cash, boom, gone, with no regard for their health.
Right.
They were making money off of it, and those places were all over South Florida, and they were just banking cash and not taking care of their patients. They were as bad as the family doctors that were out there, but they were doing worse. They were actually increasing the risk of their patients, not bad. Sure. They weren't taking care of their thyroid, they weren't taking care of their adrenals, they weren't taking care of their heart, they weren't taking care of their gut. They were actually setting them up probably for worse problems down the road, and those are the people. And the people that come in asking, me as a surgeon, well, I don't understand why I can't lose weight, I can't do this. But they're asking a surgeon. Why are they asking? They shouldn't be asking a surgeon this, because their medical doctor doesn't talk to them. And when every patient coming in goes, my medical doctor doesn't talk to me, my medical doctor doesn't answer my questions. One, they don't have the time, or two, they don't have the knowledge.
Right.
That's the problem. We can do it. So after all those years, I said finally I was sick of watching people mistreat people and just take their money, and I can look at a way that I can actually fix them. We fix them. Yeah. Change their lifestyle.
Sure.
But it kind of give them a structure that they can take forward and keep with them the rest of their life and be around longer.
Well, this is an education, and
totally.
When I always talk to my clients, I say, listen, give me 3 months, give me 6 months, and I'm gonna help you and show you how to change your life for the better. But you're gonna get an education, and you can take this with you for the rest of your life.
Right.
So it's not like you're just, like you're investing in like educating yourself on like how to make the best decisions moving forward.
100% of our program. That's what we have to do. We have to take these people, and they didn't get like this in 3 months.
No.
They didn't get like this in 6 months. They didn't get like this in a year.
No.
So they can't expect some fad diet or fad
workout
thing to get them better in 3 months if they're not even getting half treated the way they are. We take them and set them on the right road, explain why they got that way, change the things that got them that way, and then keep them on the road, and then augment that and supercharge it to get the weight off of them, get them better, get their mind, open their eyes up, get a smile out of them. We do anti-aging literally from the inside out. Literally.
I mean, I can imagine you must have some crazy stories of people that have come to you over the years, and you're, doing their labs, and the markers are all over the place. Probably hearing stories about like what their trainer had them doing, under the supervision of a physician or not. I mean, I can't imagine. Like, do you have any crazy stories that you basically like kind of like taken someone and fixed them?
First of all, I'd say about 99% of all people that go to a gym and to a national gym chain and get a trainer, most gyms in general, are not under physicians' watch at all.
Sure.
At all.
We see it all the time.
All the time, right. The diet plans, not under physician. They don't, it's not looked at, they don't tell their physicians, they don't tell their doctors and their trainers, they don't tell their trainers aren't doing, they don't tell their dietitians are not with this physician. Probably haven't even seen a doctor. If they have, they haven't gotten anything out of that doctor. The craziest stories, the craziest one we had here within this practice was probably the one woman who had a hysterectomy, both her uterus and bilateral pinguoophorectomy, so both tubes, both ovaries, both things out at 32 years old.
Wow.
She had horrible pain, she had horrible endometriosis, had some risky cells, risk of cancer. They took it all out, and her gynecologist said, "You'll be fine, don't worry, you're young," and sent her out the door. So she basically had surgical menopause at 32 years old. The woman proceeded to go from a national and international level sailing coach with kids that she was coaching for the Olympic team and beyond. Went from doing that, raising her kids, having a household, to dropping her kids off at school, driving to Publix, falling asleep in the supermarket parking lot, waking up, shopping, getting back home, dropping the groceries off to make it back to school at 3 o'clock, pick up the kids, get home, make their dinner, do their homework, and go to bed.
Just exhausted.
Exhausted and existing. She couldn't even stay awake. Didn't talk to her husband.
Wow.
Kids were there. Nothing. took care of the kids, she got things that she had to get done.
Right.
But the rest of the time she was sleeping in parking lots.
Seemed like a struggle.
Sleeping at home. No, there was no struggle, she failed. We got her back on hormones, got the weight off her, got her supplements going, and she walked in here after about 2.5 months and said, "You gave me my life back."
Wow.
Best story ever. Back to coaching sailing. She's got another kid going to the Olympic team. She's coaching 3 or 4 different kids plus an entire classes. Her 2 kids have grades have gone up. Life's better. The husband thanked us. He's now become a patient.
Sure.
And he's like, "Wow, if you can do that for her, what can you do for me?" So that's the key. And the easier thing was is that he had started the diet with her, so by them doing it together was even easier. So having the husband and wife together was huge.
It makes a big
The
difference.
kids are eating healthy. There's
Sure.
no more junk food and food for the kids because
What's
they're
the
like,
environment?
"We're not
I
gonna
mean,
feed it to
when
the
you
kids."
gotta, you don't want to bring that stuff in the house.
Why would I put it in me or my wife or my my kids? Why
Right.
would my kids? I wouldn't put it myself.
Sure.
All the stuff's out of the house. The kids are healthier. The
Kids
grades
are
are
young.
going up. Energy's better. Husband and wife are having the best relationship they've ever had in their lives. Boom, gone. Patient for life. All she does is find people.
So that's
Most
so
profound
that
change.
was like so would you call that like you just balanced her hormones? Is that essentially what happened, or could you just kind of take this?
Completely replaced.
Okay.
She was given menopause. So menopause that may have happened by 55, 60, 65.
Right.
Could start as early as 35, but usually 55, 65 is where it finally tails off. We basically replaced her hormones because she had them cut off. So
Right.
Done. Gone.
Wow.
Done. Crazy.
Amazing.
It was amazing. On the opposite end of the scale, we had a 25-year-old patient who had been on birth control since she was 15 with no holidays, no nothing. And I was lifting in the gym and fell down, had an accident while she was squatting, fractured 2 bones in her back.
So what happened there?
25-year-old, not a typical patient of ours.
Right.
Maybe for IV therapy, for hydration, for amino acid replacement, overall health. We do take care of athletes. But she actually came in with a hormone problem. Mom had breast cancer, pathologic fracture. Did she have, two spinal fractures in a 25-year-old? It's very, very unusual. So you worry, God forbid, a pathologic fracture from cancer. She got treated for the fracture by a radiologist, not a surgeon. Had difficulties with that. But after we had got into the whole story, I sat down and talked with her for about an hour and a half and went through her entire history back to the time of her first period, forward. She had been on a birth control pill from shortly after her first period until present. She had never gotten none.
So that had a negative effect.
Negative effect, Center for